If you or someone you love has just started cabergoline for a prolactinoma, this is a plain guide to what comes next. A returning period is one of the first signs the treatment is working. It means prolactin is falling and the normal hormone cycle is switching back on. Here is what to expect from here based on the evidence. A prolactinoma is a benign growth on the pituitary gland that makes too much of a hormone called prolactin. Cabergoline lowers that prolactin, and in most people it also shrinks the growth itself. It is usually taken twice a week, often with food or at bedtime to soften side effects. The dose starts low and is raised slowly, guided by blood prolactin, until the level sits in the normal range. This is why the blood tests matter more than how you feel on any single day. Prolactin often falls within weeks. The growth shrinks more slowly over months. In the large majority of people, prolactin returns to normal, and in around 8 to 9 out of 10, the growth shrinks by more than half. For women, periods usually return, and with them, fertility. Last point needs care. Fertility can come back before your cycle feels regular, and ovulation can happen before your first period arrives. So pregnancy is possible sooner than expected. If pregnancy is not wanted right now, use barrier contraception and talk to your doctor about timing. If it is wanted, plan it with your specialist. Cabergoline is usually stopped once pregnancy is confirmed, and the data so far have not shown a higher risk of birth defects. The risks of longer-term use. The common side effects are mild: nausea, dizziness when standing up, headache, tiredness. These usually settle or improve with a lower dose. A rarer effect of this type of drug is a change in impulse control, such as compulsive spending or gambling. It is uncommon, but worth knowing, so it can be flagged early. The long-term concern people ask about most is heart valves. At the very high doses once used in Parkinson's disease, cabergoline was linked to valve damage. At the much lower doses used for a prolactinoma, large reviews have found that risk to be very low. Some doctors still take a baseline heart scan and repeat it from time to time, especially with higher doses, many years of treatment, or older age. That is a conversation to have with your own team. The longer view is encouraging. Once prolactin has been normal for at least 2 years, and the growth has shrunk away or nearly so, some people can try coming off the drug under supervision. A fair number will see prolactin drift back up, often within the first year, and simply restart. It is very rare for one of these growths to enlarge without prolactin rising first, which is why that blood test is such a reliable early warning. One more point on what this actually is. A very high prolactin level points strongly to a prolactinoma rather than another kind of cyst, because other growths that press on nearby tissue usually raise prolactin only mildly. And if the growth shrinks on cabergoline, that response all but confirms it. The treatment itself helps answer the question. None of this replaces your own endocrinologist, who is steering the doses and the scans. But the overall picture is a reassuring one. This is one of the most treatable conditions of its kind, and a returning period is a sign the treatment is doing exactly what it should.